Yeah, so our study was designed to look at whether we can reduce thrombotic events in cancer patients. So cancer patients typically have very high risk for getting blood clots like a deep vein thrombosis or pulmonary embolism. And you can identify that risk based on a formal risk assessment score. So we use that risk score to identify high-risk patients, and then we randomize patients to either Rivaroxaban 10 milligram once daily or placebo to see if using Rivaroxaban would reduce the risk without increasing the risk of bleeding. It was 841 patients that were randomized. It was a massive undertaking. It was 11 countries, 143 study centers worldwide. But we were able to randomize 841 patients. The study results, we were able to show that with Rivaroxaban, you could reduce the number of thrombotic events substantially. But the real reduction occurred only during the time frame that patients were on treatment, but not during the full study period. And the reason for that was that about 40% of events in the study occurred in patients who had stopped taking the drug. I think that has implications for clinical practice moving forward. We really have to educate patients that they should stay on the drug for as long as is feasible. Yeah, so the take-home message is that cancer patients that are high risk for getting thrombotic events, we can predict that risk pretty successfully using a validated risk score. We can take high-risk cancer patients and give them a daily dose of Rivaroxaban 10 milligram once daily and reduce the risk substantially as long as patients take the drug. And we did not really have any safety concerns. Major bleeding incidence was quite low, and non-major bleeding incidence was also quite low. So we are reassured about safety.